So for this reason, WHO reiterates the important principles that must be respected in the response to COVID-19. And these are firmly grounded in human rights law, but also in international standards and norms in crime prevention and criminal justice. So there are various recommendations. I would not have time to go through all of them. I would advise you to read the guidance, but I'll just refer to one or two of them, which I think are particularly important. And one of them is the fact that when people are deprived of liberty, then it becomes a state responsibility to ensure they receive the health care they need and deserve. And this should be of equivalent standards to those that are
Nous devons avoir des normes équivalentes pour tous.
in the community. There are certain aspects that are referring to the access to safe water, sanitation, and hygiene, which have become even more important now in the current pandemic. And there are also considerations about special groups like women and, for example, children, which are more vulnerable to the effects of lockdown and particularly vulnerable, for example, to sexual violence. Finally, one that's particularly relevant for the context of this webinar is the recommendation to address overcrowding in detention settings. And this is considered by WHO a basic measure to decrease the risk of transmission. So we recommend that member states have enhanced consideration for the use of non-custodial measures, and this is at all stages of the criminal justice system. So coming to your second question, if we have data that shows that these measures do decrease the risk of COVID infection, well, we have observed outbreaks in almost every country in the European region, but in two different phases. So until September, we can see that the situation in detention facilities is much more controlled when compared to the standardized cases observed in the community. And then from October, November onwards, we can see that there's a cluster of countries where the situation becomes uncontrolled, and we can see a clear amplification of the effect observed in prisons when comparing the case rate with observed in the community. So we looked at the measures that were observed in these two clusters, and we can see that in both of them, non-custodial measures were applied. However, the extent to which they were applied varies. And we can see that the countries that are more controlled are the ones that decreased less people, which may sound strange. But then if we look at the baseline occupancy rate, we can see that the answer is in fact there, because countries that have the situation controlled are those that had lower occupancy rates. And we're talking about a difference from around 85% for those controlled to 98% as a mean in those uncontrolled. So you can see many where there's clear overcrowding. Also, there's publicly available data, namely from the UK, where you can see there's a direct relationship between the occupancy rate and the death rate observed. So as the population decreases, you can see also a decrease in the deaths recorded. And finally, there are also reports about the indirect effects of COVID that are mostly applicable to the lockdown measures. So, for example, we can see there's an increase in the number of self-harm incidents, and also an increase in riots in some other countries, some of which leading to deaths. So I'll leave it at that, Audrey. Thank you, and I'll be looking forward to the discussion.
Thank you so much, Philippa, for this great presentation, really on time as well. So now we'd like to move to Nicolas Patrick. So DLA Piper, and you've led this global analysis, released a report last week covering 53 jurisdictions around the world, and you looked at release schemes. So what are the main findings you would like to share with us today, and what should be the main takeout for our audience? And eventually, if you can also share a bit of challenges regarding the research that you conducted.
Sure, thanks, Audrey, and thanks so much to you and to APT for hosting the event, and also to the fantastic co-speakers that are joining us on the panel today. DLA Piper is a global law firm, and in our pro bono practice, we have many human rights lawyers who, amongst other things, support governments, particularly in the least developed countries, on a range of law reform initiatives. And we have had some experience over the years in supporting prison and corrections reform. And it was really with a view to supporting our clients, as I say, particularly governments in the least developed countries, to develop effective policy proposals and implement effective systems to reduce prisoner populations. So we looked at 53 jurisdictions with a view to identifying effective approaches, examples of good practice, particularly those that could be adopted and replicated elsewhere. In terms of some of the findings of the report, I guess the headline is that it just covers a few months between March and July 2020, and in that period there were 475 prisoners, both convicted and also pre-trial, released just in those 53 jurisdictions in that short time frame. And we identified a number of transit practices. So I'll just run through a few of them. In terms of the mechanisms by which prisoners were released, virtually all of the jurisdictions included in our study used existing mechanisms, which had, of course, the advantage of being available immediately, and so speed was obviously a significant advantage. But we also found that the most effective programs supplemented existing mechanisms with additional measures, and those additional measures pertained particularly to elderly or vulnerable prisoners who, for example, might not have been captured by some of the existing mechanisms that countries had in place. In terms of the approval processes for prisoner release, approval was commonly required to be given by a government official. In some cases, it could be the president or the state governor or minister. This was often done through executive pardon or clemency. That was the case in about half of the countries we looked at. A similar number of jurisdictions, 43%, relied on release approval being granted by public servants. And I think what we saw was the use of administrative decision-making, even within a strict framework, could be quite an effective way to quickly reduce prisoner populations. But we would recommend, and we saw examples again of this, that those administrative decision-making frameworks have to be supplemented by a parallel judicial process, just to ensure that the system achieves fairness either through the exercise of judicial discretion or judicial review. In terms of eligibility criteria, almost all of the jurisdictions we looked at applied at least three sort of key criteria. So the first one, they looked at the nature of the offence that the prisoner was convicted of committing. They looked at the nature or status of the sentence, and they looked at whether the prisoner had particular vulnerabilities. So in terms of the offence, it was mostly non-violent or minor offences, and people who therefore posed no great risk to the community. So that was in 83% of jurisdictions. The focus was on non-violent offenders. Serious violent offenders and sexual offenders were often called out as being ineligible for early release. Only a quarter of the jurisdictions we looked at actually thought about and took into account whether the person had been charged with historically or convicted of domestic violence related offences. And one of the things I think we're all aware of by this stage is that in many countries there has been reported sort of increased incidents of domestic violence. So one of the recommendations in the report is that the risks posed by the release to a domestic partner should be considered as part of the decision-making framework. I'm just conscious that I'm speaking quite quickly, and we were asked not to do that, so I'll try to slow down a little. In terms of the status of the person's sentence, a number of jurisdictions, about 85% of them, tried to focus on prisoners who were coming towards the end of their sentence or had served, the vast majority of their sentence, and they were able to be included within the early release program. And then, as I've mentioned, in terms of vulnerability, about 62% of the countries looked at vulnerability and included elderly prisoners and those with chronic health issues in the prisoner release program. There was only a quarter of jurisdictions that had special provisions for female prisoners, particularly those who were pregnant or breastfeeding or who had children living with them in detention. Also, in relation to children, only a third of jurisdictions released, only a third of the jurisdictions we looked at anyway, released children in response to the pandemic during those early months. Some jurisdictions took an approach that there would be a blanket release of any child held in detention facilities. But as I say, there wasn't any great sort of movement in terms of children in detention. And it's worth noting, I think, that, as everybody on this call probably knows, children really shouldn't be incarcerated except as a measure of last resort. And if that principle is applied, then obviously there's perhaps less opportunity for early release. I think also as time went along and we understood the risks posed by or to children by COVID were less than for the adult population, particularly elderly, vulnerable people, the focus probably shifted away from children. So I'll just mention a couple of others quickly without going into detail. If people want to pick up on them, we can in the questions. A third of jurisdictions looked at the availability of accommodation after people were released. I think that's very contextual, in terms of a lot of the least developed countries. That's not something that is typically considered, what support people will have after they leave. Half of the jurisdictions also released prisoners who are in pre-trial or remand custody. And also, at least half of the jurisdictions had measures to reduce new prison admissions, and I think that's extremely important. If you're bringing in more and more people to just replace those released, then obviously you're not going to get any overall reductions or decongestion. So look, I might just leave it there. There's a lot more data, a lot more recommendations and findings in the report. It's available to all of you to have a look at, and I'm happy to go into more detail, as I said, in the discussion.
Thank you so much, Nicholas. It was fascinating. It's indeed quite a dense report. We're going to share the link on the chat. And I would like to invite now our, and we will have lots of opportunities to discuss the findings. So I would like to invite our discussants, Danielle Diaz from the NHRI National Human Rights Institutions of Uruguay, Trina Lenihan from Penal Reform International, and Laura Lai from Independent Policy Drug Consortium. They're going to ask our great speakers a couple of questions, and then I'll go back to Nicolas and Philippa. Trina, do you would like to start? And then we go with Gloria and then with Danielle. That's okay with you?
Sure, no problem. Thanks, Audrey, and thanks, Philippa and Nicholas, for your presentations and for the report itself, which, as Audrey mentions, is significant, and it'll be such a useful resource for all of us working in this area. I guess one of the main things for PRI when we're thinking about, the releases that have happened over the last year is that we've seen in so many places such a significant difference between the commitments that were made or the number of people that were expected to be released under some of these mechanisms and the number of people that were actually released in the end. So I think it would be useful maybe to hear from Nicholas a bit about what were, some of the more common challenges that you've seen as part of this research in implementing the releases and sort of getting the maximum benefit in terms of reducing overcrowding in prison populations. Another area I think that comes to mind for us is around the population groups within prisons, and who sort of benefited the most and the least maybe from releases. You've mentioned some of the sort of key population and vulnerable groups that were included, but it would be good to hear maybe a bit about who was excluded. You mentioned the sort of more serious offences or longer term. I guess we've seen in some places where, for example, people serving very long or life sentences were excluded, which are not always necessarily for sort of what we would consider serious or violent offences. So things like exclusion of drug-related offences, which I'm sure Gloria will pick up on as well. And I think a question that comes up a lot in relation to all of these sort of larger release mechanisms is around support and what supports are provided for people when they are released, particularly when, you know, these mechanisms were maybe implemented relatively quickly. And so looking at, you know, supports that are important at any point when someone is released from prison, but particularly during a pandemic or a health crisis, and if the community is in lockdown or under different regulations. So in terms of sort of access to information or, you know, practical supports. So it would be good to hear sort of what you found was available and what, you know, should be available for people leaving prison during this time. I have so many thoughts and I don't want to overload you, but I think maybe one final thing might be, I'm conscious that the report covers the time to July last year, but we've seen, particularly, for example, in Europe, where we have access to the Council of Europe space data, where a lot of countries managed to reduce their prison populations during that time last year, but subsequently, you know, some countries are seeing an increase again from about September. And this is despite, you know, second waves coming later in the year and peaks of infection rates in the community again. So we don't seem to have that same sense of urgency or the consistency or, you know, sustainability of these reductions. So it'd be good, yeah, if that is something that can come out of the discussions today about how we can all sort of collaborate and advocate to keep that momentum going and ensure that the gains that have been made in reducing overcrowding are maintained, and that we sort of keep that issue on the agenda.
Yeah,
thanks.
they're all great issues. Most of them we do touch on in the report. I started noting them down after the third one, where I thought I probably won't remember if I don't start writing them down. So I'm going to work backwards, and then if I'm missing, you can pick me up. So, yeah.
Yeah, if you don't mind, are you okay if we go through the other questions and then we do collective? Okay. If it's okay with you, because maybe I think
I have to keep a better list.
Thank you.
Okay.
I think that
yeah, no problem.
it's a lot. Thank you so much, Gloria and Danielle, and then we'll go back to Nick and Philippa. It was really rich, Gina. So I hope we can cover it all. Thank you. Sorry.
Yeah, is it okay if I kind of pitch in a bit now? I think maybe my input to follow on from Triona's would be maybe more from an advocacy perspective, and then certainly, I mean, what Triona touched on about in terms of the eligibility criteria for people for prison release programs. We advocate for drug policy reform, so we pay obviously more attention to people in prison for drug offences, and a significant proportion of people in prisons around the world are there for drug offences, and of them a significant, pretty large proportion are for drug possession and for drug consumption. So by definition, non-violent offences. There was some research done by Harm Reduction International and NGO, like looking at prison release commitments between March and June last year, and they found that about a quarter of those countries had specifically excluded people in prison for drug offences from prison release schemes. I mean, this is something, it kind of brings to mind, particularly I think in terms of advocating for prison releases, and kind of makes me think back to what do you see are the kind of the motivating factors for countries? I mean, besides COVID, was that the kind of the main thing that pushed countries? Like, I know that the fact that a lot of countries have really overcrowded prisons. I know that, say, for Indonesia, COVID brought in a window of opportunity to push for certain people from government. It was a motivation to push for people to be released from prison. Like, that was already there even before COVID. And so I think I'm interested to know, particularly in light of also what Triona kind of alerts to around, like a return to increasing rates of people going in prison, what kind of maybe messaging do you think resonates with policymakers and the public in seeing less use of custodial measures?
Thank you so much, Gloria. Very rich questions as well. I'll go to Danielle. You can also share your views, ask questions, and then I'll pass the mic to Nicholas and Philippa. Will have 3 to 4 minutes to respond, but then we can also build on that during the question and answer.
Muchas gracias a todos y todas. Es un gusto participar en esta instancia. En realidad, escuchando a Nicolás, los planteos y los aportes que realiza, a mí se me generan un par de temas que me parece importante conversarlo o ponerlos a consideración. Primero, pensando en la realidad nacional, en la realidad uruguaya.
First, let's talk about the national reality in Uruguay. We have in the last times a great increase in the number of cases of COVID, as it happened in many countries. And somehow people had not entered in the penitentiary system until November of 2020, and now we have more and more contagion, a greater number of people in isolation, and the first attitude that was of prevention is now falling, and we are facing a situation of contagion. And this exponential increase of people contaminated, it seems to me that it's very important to talk to you that Uruguay has increased the number of inmates. So they are not releasing people. We don't have early releases due to COVID. We have increased the number of people who are in prison. And we were among the first countries in Latin America. We see the rates of prisons and detention in Uruguay that are increasing. So we only studied case by case. We had individual measures motivated by public defenders and motivated by the prevention mechanism. It was very important to analyze the situation case by case, but we were able to see that the courts wanted that the prison increased. So we didn't have this meaningful repercussion, and this number of inmates is still increasing consistently, even during the pandemic. Today, we have more people arrested than before the pandemic, and we have this meaningful number of legislative reforms that increased the sentences. So this is our current situation. And by listening to Nicholas, he was saying that they use mechanisms that existed in some countries. Uruguay also has this kind of mechanism, and we had to use additional measures. In the case of Uruguay, the situation was analyzed case by case, and the request of home arrest and not release. And I wanted to understand more about the eligibility criteria. We've had many different criteria when we had to think about the eligibility of people. And many times we had to talk about health issues, and also they have given the chance to these people to have a place to go when they left the prison system. So the question that I'd like to ask is, I'd like you to delve deeper into this eligibility criteria and about the social criteria and also the legal barriers. So in the case of Uruguay, we had the release period limited, and also the early release that was very limited. Thank you very much.
Thank you so much. I think also thanks to the interpreters who did a great job. Daniel, you speak very fast, but was very good. Wow. This is a very interesting type of question. So I will suggest, Nicolas, you would like to start and maybe build on the reflections. Then Philippa, you can also complete. We're going to give you maybe 4 to 5 minutes if it is okay with everyone. Then we'll go with our other speakers we're going to speak from the practice, and we still have some time at the end. If you want to add anything else, Nicolas and Philippa, you wouldn't have time. So sure. The mic is yours.
So the first issue that I'd like to pick up on is in relation to those who were excluded. I think this is particularly interesting for me because I've seen it in a number of the countries where I work. As I say, many of the least developed countries have got a particular problem with overcrowding and also a particular problem with like an aging prison population. And the issue comes up because in many of the countries where I'm familiar, a life sentence means you're there for life, and it's not defined as 20 years or 25 years. And so that is one, I think, issue that a lot of people who are convicted, particularly of violent crimes, end up with a sentence, which could be a life sentence, and it could mean life, or they could end up with like consecutive sentences or a number of sentences that might add up to 100 years or more. And in some cases, it's unclear whether those sentences are consecutive, whether there should be a cap on the number of years somebody serves in jail, and so there's a lot of people sort of who are elderly, who pose no threat to the community, but are kind of stuck in the system. And if they've been convicted of violent crimes, they were often excluded. So the point Triona made, I think, is a really good one. And there's definitely need for reform, not just in relation to early release programs, but also in relation to defining like maximum terms or term limits. Yeah, I think this is a known issue and a known challenge, and I don't know what the solution is in terms of COVID. I also wanted to pick up on the comment about, I think it was made in relation to Indonesia, and that reflects also, what we're seeing, and that is that in many countries, there's basically bipartisan support for the concept of prison population reduction, and it generally comes from not related to health concerns, but often just related to the cost of incarceration and or overcrowding and the strain on the justice system. And I think the other important one, I suppose, as well, is another important driver is concerns about the health and safety of staff. I think perhaps more than the prisoners themselves is something that comes through. And I think these are all levers that we can all pull on in terms of trying to encourage better approaches to prisoner release. It was, for many of the countries that we looked at a case of never waste a pandemic, and it was used as an opportunity to achieve other kind of policy objectives that weren't necessarily related to prisoner health. And you can see that in some of the statistics that we published. So, for example, if you look at the releases that occurred during the period of our survey, 83% of them were permanent. So, there was only 17% who were required to come back at a later date to serve out the rest of their sentence. I think in terms of the kind of effectiveness of programs, one of the things I would say is, for the countries that had already good alternatives to custody, they were able to use those mechanisms to great benefit here. And I think for the countries that haven't really invested in looking at alternatives to custody, they perhaps were a little bit more challenged in terms of the options that were available. And so one of the things I have already seen is a kind of increasing interest in investment in alternatives to custody. And hopefully, that might result in people being directed away from full-time custodial sentences. In terms of support, well, we found that in 70% of the countries that we looked at, there was support for prisoners post-release. However, there were very few, I don't think we found very many at all, kind of new support programs introduced during COVID as part of these new early release schemes. So they were sort of 70% said, yes, we did have some programs, but it's really unclear about just how practically accessible or effective those programs were, particularly during a pandemic. So I think we just don't know. I think it's very difficult. We didn't look at kind of government forecasts or guarantees or promises about how many people would be released. We just started with the data about how many people would be released. So I can't really respond in terms of that question about like expectations versus reality. I do think in terms of maybe one of the things I think that needs to happen going forward in this space is that we need to encourage better governance. I would say good government practices, good governance practices, where there's a proper assessment of how much a piece of legislation is going to cost to the justice system when it's introduced into law. And so we don't just keep continually creating new crimes with longer sentences without kind of forecasting what the impact is going to be on the government's finances, on the public purse. And I think there needs to be more kind of accountability in that space, and that will make a big difference. And I'm sorry, I'm not really able to comment too much on the situation in Uruguay. I think what all it really shows is that a lot of this comes down to political will. And I think every country is in a different place on that. And often it's driven, I think it's driven more by society than by government and by policymakers. I think policymakers, government, particularly elected officials, are quite scared of like, what is the public backlash going to be if we're seen to be releasing prisoners or if we're soft on crime? But my sense is, from my work and also from the study, that the governments are probably a bit more progressive than the community in many places. The governments are just a bit scared of getting ahead of community sentiment. And so I'm not sure how useful that is as a reflection, but what's required is maybe a little bit more kind of social change rather than legal change. I think the law is always going to have to catch up to community sentiment. And I'll just leave it there because I think I've covered as much as I possibly can in my time and more.
Thank you so much. I think this is raising lots of interest. I'm also pleased to see the question and answers and the chat starting to have some movements and questions for you. Philippa, would you like to provide any additional comments or inputs?
Sure. So yeah, although most of the questions were specifically addressed at Nicholas, I would just add a few points. One was from Trina, where she mentioned the gap between expectations and the real numbers of people released. And I would like to highlight here that although that is true, there were not that many countries where I could see scenarios being made to back up the request for a specific number of people to be released. There were some countries where this was made, and it is true there's a gap. However, the release measures were one of the measures that is useful to prevent and control COVID. But the main reason for this is also because to create more space to quarantine, to isolate cases and all of that, as you all know. So there were countries that, although they did not meet the targets, the outcome was better than expected. And the main reason was because they created alternative mechanisms to to create safety measures like cohorting strategies, reverse cohorting and all of that, and creating additional spaces that were specifically made available for these measures to be possible. In terms of mechanisms for the support provided to people that are released, yes, I agree with you totally. This is a problem that we have already highlighted not much before the COVID pandemic. There's a big division between, there's not a continuity of care between the period of incarceration and the period post-incarceration, and that's where the problems exist. We have been trying to make some efforts in terms of putting the different governments, the different ministries responsible for prison health and for community health, working more closely together to decrease this problem in continuity of care. But at the moment, I don't see that much yet has changed as a result of the pandemic. So that's definitely an area that needs to be strengthened, and perhaps also more in terms of interlink with the social sector, definitely, which is something that's currently not captured. Also, in terms of the increase that has been observed recently, we do have the same figures, although in our figures, we see a more marked decrease and a slight increase. So it's not yet coming back to the previous figures, but we are aware of that. And because of that, there will be soon a UN statement position produced that is aiming to reinforce the efforts to place incarceration and its overuse high on the political agenda, and to have some additional advocacy so that member states put this as an aspect of main concern. And in this position statement, which we hope will be out soon, we also refer to the decriminalization of acts, an aspect that was raised by Gloria. And in fact, there's also some initiatives being made in terms of, specifically for drugs, in terms of diversion to treatment as an alternative to punishment by incarceration, very much driven by UNODC. So yeah, these are my comments for the moment. Thank you.
Thank you so much. Thank you for these initial comments. Thank you, Nicholas and Philippa. Please remain online. We're going to have another question and answers coming up at the end of this session. You can also look yourself at the questions from the speakers and respond. Okay, so now I would like to invite our colleagues from South Africa, the Philippines and Brazil to come and share with us how it is really working in practice. We have Christopher Nissen, Commissioner for the National Human Rights Commission of South Africa, Gerbert Brayola from Task Force Detainees of the Philippines and the CSO members of the INPM, Interim National Preventive Mechanism, and Suriela Youssef, who's a public defender from the state of Sao Paulo. The Philippines, South Africa, and Brazil are countries where you have a very high number of detainees. So it's going to be very interesting to hear from their perspectives. Christopher Nissen, if you would like to put your camera on. Hi, Chris.
Hi, good
How are
day.
you?
Fine, how are you?
Fine, thank you. So thank you so much for joining us. Now I would really like to hear from you. Last May, the president announced a vast program of early release, and we'd like to know how is it happening? How is it really take place in practice? Are there any good practices you would like to share? And you also, as a Commissioner of the Human Rights Commission, you do monitor prisons in times of COVID-19. So what is the current situation regarding overcrowding and early prison schemes? You have, yes, more or less 5 minutes.
Thank you so much. Good morning, good afternoon, good evening to our colleagues in different parts of the globe, and also to APT. Thank you so much for our partners, that we could share some of our experiences. but also listening to the colleagues from different parts that have spoken earlier on, there are a lot of similarities. But let me just say that in our country, every year the president has what we call a presidential pardon, in which he pardons prisoners or offenders. In our case, we use the word offenders or inmates, and then he pardons them. But that happened in December, just before the announcement of the lockdown. In our country, we had 5 levels of lockdown. The first 2, 5, and 4 were severe, and then 3, 4 were better, and lockdown level 1, in which we are now, are much better because there's much more movement. Movement is not restricted, etc. So we, as the Commission and NPM in particular, we operated throughout those lockdowns, level 5, 4, 2, 3, and 2, and now 1, because we were declared in essential services, and so we could visit places of custody, including correctional centers. I'm joined by Dr. Kwanele Pakate, the head of the NPM in the office, and then of course with Kaya Tulane in Cape Town office, and then Nokwanda Nzimande and Katleho Molopo as the 2 researchers. That's the team, and Sibo is not here, but we're a team of 6 people constituting the NPM. The president during the level 5 of COVID-19, given the fact that our prisons, our correction centers are overcrowded, and wanted to make sure that that in the event that anybody contracts it, that doesn't spread like a wildfire, but also cut off visits from the public to the center. And obviously, some of the correctional center members contracted the virus first. And then, of course, 1 or 2 were then spread in the different centers. But what has happened is that 19,000 offenders were pardoned or were eligible for early parole. But those offenders, there were 3 criteria. Like, for example, your sexual offenders and murders and lifetime were not eligible for parole. But nevertheless, they were in excess of 7,000 or released during the beginning of that period. The sad thing is that the number of those parolees came back because they offended again, and offended really serious crimes, including the murder and the rape of young children. So they were brought back. In terms of what support was there from outside, we do have a number of NGOs, and NICRO and a few others, NGOs that are supporting returning offenders. But clearly, the issue was we feared that if an outbreak in any of the centers would have created havoc, and many people have died. At the beginning of the level 5, the NPM in South Africa issued an advisory note, particularly to correctional centers, as to how to deal with the pandemic. And also our interaction, including meeting with the senior leadership, the National Commissioner, including National Commissioner, on level of COVID-19, and also to explain, and then for them to explain to us what are the programs that they're putting in place. So amongst others, they, for example, have dedicated centers where people suspected of or showing symptoms or being tested will be taken, and they'll be isolated in those areas. And also in the center itself, there will be certain holding cells that will be dedicated to COVID-19. And must say, we just recently visited a center in Boksburg, outside Gauteng, outside Johannesburg, and we were suitably impressed with the infrastructure, from bedding to sanitation to all of that, and toiletries and so on. So they've put all of that in place. And so also they've got a daily score sheet that they have to fill in on COVID-19. It is from the number of offenders to the actions taken, sanitization of the cells and of the members and all of this, and those daily score sheets have to send to the national office so they can see what's happening in the different centers. The problem that South Africa face is that, and the correctional centers face, is that the overcrowding is being caused by the high remand detainees, not by sentenced offenders. And the reason for that is that sometimes bail is not granted. You'll find a person for a petty offense having a $10 bail that the person cannot pay, but he's sitting there, and it costs the state a lot of money. So we have engaged them to see how you can reduce the high number of remand detainees. And we've also looked at it from the sense that we need to deal with government on the level of bringing down the petty of doing away with the petty offenses. Because the petty offenses, the economic offenses such as shoplifting, stealing something from a shop, and the person cannot pay bail. The person stole because he or she's hungry, and now he or she cannot pay bail, and there's now sitting in prison. And so that is the issue. That's an ongoing debate that we have with regard to them, and so on. So we are dealing with that. And but as the team, as the NPM team, we have been visiting since level lockdown 5. We engaged with the different authorities. Level 4, we did visits to the centers up till today. Last week we returned from East London. But as far as we're concerned, yes, we have these problem challenges and so on, and we need to build more correctional centers, but we are beginning to see how our input is being taken very seriously by the national authorities and the national leadership of correctional centers. Thank you so much. Sorry about going over time.
It's okay. It's a lot of information to be covered in a few minutes. You'll have opportunity to come back as well to some of the issues. Thank you so much. So we have now with us Jabat Viola from the Philippines. We also know that the connection may be complicated. We would like you to explore and share with us your views about early prison schemes in the Philippines. We know that it's one of the countries where you have the highest level of overcrowding, with figures such reaching as 500%. And we know that some of prison reading schemes have been adopted last year. So could you share with us a bit some lessons learned of the program? Can you have some perspectives on the findings of the global analysis? What would make it work in the Philippines as well? So please, the mic is yours.
Thank you, APT, for inviting us in this webinar. Good morning, good afternoon, good evening. My organization is Task Force Detainees of the Philippines, TFDP. We are a human rights organization established in 1974. Currently, during this pandemic, we are remotely monitoring, documenting, and reporting alleged human rights violations, particularly those violations who are committed in the context of quarantine. While we know the appreciation, the actions made by our government, by our authorities, in addressing the dismal state of our jail conditions, Audrey is right. Our jail congestion rate, according to authorities, is at 534%. So we describe it as a death trap, or persons deprived of liberty are living in a death trap once you are detained in our jail facility. And this condition exacerbates more when Duterte or our government started to implement the government's war on drugs. Aside from numerous or escalating number of victims of extrajudicial killings, the number of persons deprived of liberty exacerbated, particularly when the Duterte administration started this campaign. However, the Department of Justice is taking steps to expedite some of the releases of persons deprived of liberty who were arrested due to alleged violations of Dangerous Drugs Act. Some of them were arrested due to violations of quarantine measures. But these measures are not enough. We have yet to, those measures is yet to be felt by many, particularly who are those individuals who are detained in places of detention. Before the COVID-19, the Philippines, according to our jail authorities or the Bureau of Jail Management or Penology, said the Philippines has the highest rate of jail congestion in the world. Could you imagine 534% over capacity? So the pandemic isn't the only reason why the Philippine jails has a jail crisis or the humanitarian crisis. When you look at closely, it reveals the overall problem of our criminal justice system, and it reveals a problem years in the making. That's why the Philippine jails look like a COVID-19 time bomb. We describe it as the situation right now. And I share the key findings of the report by DLA and APT that releases of persons deprived of liberty, and I quote, must however be coupled with a simultaneous strategy of limiting new prison admissions to ensure that release of prisoners are not simply replaced by new prisoners. So it's look like a replenishment. So I completely agree with the finding of the DLA and the APT that the authorities should have more inventive ways or strategies in order to reduce the jail congestion population in our country. And at the same time, I also take note of one of the findings of the DLA about the availability of verifiable and factual data. Among us, the civil society organizations, we are kept in blind. We are left in the dark. How can we intervene? How can we intervene to our beneficiaries who are inside the prison jails, since we don't have any available data? The government websites and some of the press conference of our authorities are, may I say, more of a publicity stunt and at the same time they are not truthful enough to say the real condition of the prison conditions. So of course, the Bureau of Jail and Management Technology implemented various mechanisms to limit the infection and spread of COVID-19 inside jails. But of course, it's next to impossible how to ensure physical distancing inside the jails and the frequent hand washing inside our prison jails. So our Supreme Court has introduced some innovations, particularly the use of remote court hearing, or we call it e-hearing. And they also introduced the online filing of bail or online filing of release and recognizance. But still, the problems persist. The congestion, the prolonged trial detention, and at the same time, borrowing our prominent human rights lawyer, Attorney Ted Te, jail decongestion in the Philippines is not the only issue. The issue is the case decongestion also is. So there are many cases lagging in our local courts. So I leave it to that, then I'm looking forward to the exchanges. Thank you.
Thank you so much, Jabba. And it was really interesting to hear your views and perspectives on the findings of the report as well. Thank you. Now we'll go to Brazil. And Israeli. Thank you so much for joining. Brazil is also a country where you have a really high number of detainees, and you work in the state of Sao Paulo as public defender. So in March 2020, the National Council of Justice adopted the resolution number 62, which recommends to the courts to adopt preventive measures to avoid the spread of COVID-19 in the criminal justice system. So could you please share with us how it is really working in practice from your perspective of public defender, and also some of your comments on the findings of the report?
Good morning, good afternoon, good night. Thank you, Audrey. Firstly, I would like to thank Sylvia and Audrey for inviting the Public Defender State Office of São Paulo to participate. And since the webinar counts with simultaneous translation, I'll be speaking my mother language, Portuguese. So if you don't speak Portuguese, please turn the translation mode. Primeiramente, eu queria destacar, Audrey.
First of all, Audrey, I would like to highlight how prison in Brazil is a violator of rights. From the 300,000 people dead by COVID-19 in Brazil are mostly Black and poor, these people are also selected by the justice criminal system in Brazil. Public Defender's Office is an institution responsible for the legal assistance of people who don't have resources and to protect the human rights. The Public Defender's Office during the pandemic carried out a series of inspections in the detention system, and the narrative of the people that are in there is the same. COVID-19 is another argument used for punishment in an overcrowded environment without access to public health, without the measures of social isolation, and without access to hygiene and medications. In fact, the main measure adopted by the Brazilian government was the 62 resolution from 2020, approved by the National Council of Justice, that established sanitary measures and monitoring of the prisons, and 3 other measures that are disincarceration. The reduction of the temporary inmates, the pretrial detainees, the reevaluation of the pretrial prisons that were already sentenced, and the exceptionality of new pretrial detentions. Alternative measures for women, elders, disabled persons, indigenous persons, and persons who have committed crimes without severe threat. And also giving option to people who are in overcrowded detentions who have some type of chronic disease. For the convicted prisoners, we have determined the release or the anticipated progression of the sentence or household arrest with or without electronic monitoring. The National Council of Justice gave special attention to the women and also to the people who are incarcerated in overcrowded detentions. For the adolescents, the Resolution 62 also determines that we should prioritize alternative measures to incarceration, such as social educational measures and open environments. In the DLA Piper report, we have some similar characteristics, like the need to judicially assess the sentences, the focus on inmates with specific vulnerabilities, and people who are sentenced for crimes without violence or severe threats. The curious thing is to observe is that most of those recommendations in Resolution 62 reinforce and encourage the judges to apply alternative measures that are already predicted in the Brazilian legislation. Despite this brave initiative from the National Council of Justice to establish a disincarcerative measure, apart from rare exceptions, like the Public Defender's Office of Espírito Santo and Ceará that allowed the provisional release or the prohibition of the arrest of people who are in debt during the COVID-19 pandemic, what we saw was a resistance to apply this recommendation 62. The judges say that imprisonment does not generate a bigger dissemination of the virus. And they say that there's no risk to the health of the people who are incarcerated. They even say that the dissemination is controlled inside the detention centers because they underwent tests, COVID-19 tests, which is a lie because not everybody inside those detention centers had undergone tests. And to finish, I would like to mention how we are witnessing the implementation of the Recommendation 62. As soon as the recommendation was approved in 2020, the National Association of the Members of the Public Prosecution's Office questioned the constitutionality of this measure in the Supreme Court. The recommendation suffered restrictions, as Rede de Justiça Criminal mentioned, and a civil society organization. They allowed online custody hearings as a rule, and they restricted this recommendation in cases of domestic violence, money laundering. And we could see in a research that was carried out by the Public Defender's Office of São Paulo, from 29,000 processes until June 2020, only 13% had a release warrant. In the Justice Court of the State of São Paulo and the Justice Court of Rio Grande do Sul, we could see collective habeas corpus that did not have a success at the end of the process, especially for those women who are breastfeeding and those women who are pregnant. The National Council of Justice reported that 35,000 people were released in the country, which represents 4% of the total of people who are in jail. In the state of São Paulo, what we saw was a reduction from January to December of 2020 of 18,000 people who were incarcerated. We know now that it is possible to release people. The judiciary needs to respond well to those measures, and the executive as well, because we can see a lot of resistance from the judiciary and from the executive regarding a recommendation of this kind. Thank you very much.
Thank you very much, Riley. That was very, very rich. We have more or less 20 more minutes for the discussions. So we'll see whether we can take some questions from the audience, but at least I've seen that you speakers, you have been engaging. So please continue doing so. I would like to invite Gloria, Trina, and Danielle to provide short comments or questions to our speakers, and then I will invite our speakers to comment again. So please, I would invite you to be brief as well in your comments and questions. Gloria, would you like to start?
Yeah, I think I'll just be very brief and maybe just highlight the point about when people are looking at non-custodial measures, and this is a point that's been raised in the question, to question how effective they are and whether to what extent they're actually causing further harm.
Thank you so much. Trina, do we like to ask questions, provide comments to our speakers?
Yes, thank you. I'll be more concise this time. I know we're under more time pressure. Yeah, I think I just wanted to come back to maybe something Nicholas mentioned in his responses earlier, in relation to the sort of support for releases and measures to reduce the prison population, which I think is an important issue for us sort of as advocates to think about, you know, and how we can get that sort of political will, engage that political will, and also think about relationships with the media and how these things are portrayed in the media. So maybe we've seen in a couple of countries, you know, where maybe some of the challenges around implementing the mechanisms may have been influenced by that sort of public reaction. And I guess, yeah, thinking about ways that we can maybe work with the media, with community groups, with maybe people affected by crime, and think about how we can change those attitudes and create a better awareness and understanding of why these measures are needed and the risks that they do or do not pose.
Thank you. Danielle, would you like to have any specific questions for our speakers?
Gracias. Bueno, retomar lo que había dicho el participante.
Thank you. I'd like to talk about what was said by the participant from Philippines. There was an existing crisis in the prison system that is getting worse during the pandemic, and and after the pandemic, it's going to go on, I believe. So we have to talk about the role of the public defenders. And many times the judicial system today have talked about the normative resistance that is connected to political aspects, but also about the justice system itself. And I identify a lot with many speeches. For instance, I identify with the public defender from Brazil because she's experiencing a scenario that is very similar to Uruguay. And lastly, how necessary it is to bring this discussion to the public so that we can improve this legislation and also have repercussion in practice. So we have to bring this discussion to the public, this connection between health and the prison system. It's impossible not to think about that in connection. So we should think about new measures. Thank you very much.
Gracias, Daniel. So, Christopher, would you like to provide some comments on the questions and the issue of public reaction as well, and the role of public defense? Then I would like Jabert, if you want to add anything, as well as Riley. Christopher, I'm looking at my screen. Are you with us?
Yes, I'm here.
Okay.
No, I think I'm concurring with most of the issues. Obviously, we have got a unique situation in South Africa. You know that we have a situation where I think our authorities listen to us. They may not do everything that we're asking them to do, but they listen to us. And it's a pity that my colleagues were not on. Otherwise, because I wanted them to share as well, because we really have a collective approach in terms of what we're doing. But thank you so much.
Yes, Audrey.
Yes, Jabert.
Yes, Audrey, I shared the reflection of Miss Trina regarding the working with media, because in order to address the gravity of the situation, particularly the situation of persons deprived of liberty, the authorities should or must build trust within the community, the trust building, because with their dismal performance in addressing the COVID-19, maybe it's time for the authorities to build trust, particularly among the CSOs. At the same time, the urgent times require inventive but responsive measures. So maybe the authorities should think out of the box. They should, of course, using the available legal framework in order to address this ticking time bomb of COVID-19 inside the Philippine jails.
Riley, would you like to add anything?
Yes, I would like to comment Trina questions about the support people receive after release. I'll be speaking in Portuguese again. Em relação ao suporte das pessoas,
Regarding the support that people have after release, this is a very important point in Brazil. We don't have a coordinated measure in this sense. Many of the support centers remained closed during the COVID-19 pandemic, and the people who are sentenced or arrested, they cannot access these social benefits like the emergency fund or the Bolsa Familia program. So we see an increase of inequality after the disincarceration, not only during the COVID-19 pandemic, but during this whole process of the super incarceration that Brazil has been experiencing. Regarding the mobilization of the media in response to the disincarceration measures, the family members and the associations have shown the impact of prison and incarceration and the prison violence has had in the lives of those families. I think this work of the media has been very important. And we have a negationist president that
do encarceramento, de aumento da violência, aumento do uso de armas e da força pública. Então, isso
neglects the increase of deaths, that neglects the increase of the incarceration. And that shows us that incarceration is not the response to our social conflicts in Brazil. These are some points that I would like to mention. In relation to Danielle's question, there is a resistance of the judges, and also there is a resistance from the public prosecution's office in applying those disincarceration measures. I think there's still this huge resistance.
Thank you so much. Actually, we have 8 more minutes before we get to the closing. So I would like to invite my colleague Veronika Filipeschi, who has gathered a few questions on the chat. And then I would like to invite the speakers to provide final comments on these questions, 1 or 2 minutes, if this is okay. And then we'll go to the concluding remarks. I'm also very grateful to the speakers for having responded to the questions and answers asked. So Veronika, would you like just to share with us 2 main questions that haven't been responded yet?
Yes, thanks a lot to all the speakers and discussants, and thanks a lot to the audience. There have been many questions, and many have been already replied by the speakers and discussants as well. So I also invite you to look at the question and answer section to see the replies. In terms of the maybe open questions that we have selected, I think a couple fall under the issue of eligibility criteria for early release scheme, in particular the criteria of vulnerability, situations of vulnerability of the detainees. And here we had a couple of questions by the audience, and one is about the particular situation of trans persons deprived of liberty that were not benefited in the context of Mexico, for instance, that were not benefited by early release schemes, even though they are a population of in situations of vulnerability in prison, but because of there are still sex gender prejudices embedded in decision makers in those who take decisions about release scheme. And the other point about the situations of vulnerability is that, for instance, in Brazil, one of the person who posted this message basically said that at least a large part of the prisoners are young people, but because of the risks criteria, basically, in terms of health situation, they don't, the release of those people with health issues or more at risk of contracting the COVID-19, basically, this didn't cause much impact on prison overpopulation. And moreover, like the presence of the tuberculosis and HIV/AIDS, for instance, and other diseases, also the question was whether these can also be factors that place the entire prison population as a risk group as a whole. And then finally, I think another question maybe a nice way to end the webinar is about next steps. So a question is to all presenters, all speakers and discussants, is to know your views as to the best way to join efforts going forward so that countries can continue working on strengthening and increasing their alternatives to detention. So it would be interesting to see your reflections on these points. So I let you.
Yes, thank you so much, Veronica. Difficult to take all the questions, and I know some of you have raised your hand as well. We're really sorry because we couldn't take all the questions live, and I hope it's okay for you to share via the Q&A questions and answers. I would like, for the few minutes we have left, if you want to turn on your camera, all speakers and discussants, and share your last points. Nicolas, you would like to share a few words, then we go with Philippa and the rest of the speakers, yeah?
I think in order to end on a positive note, I would just say that I think one of the things that this experience has shown is that it is actually possible to make significant reductions in prisoner populations. Over the last year, there's probably been 1 million people released from prison, mostly non-violent offenders. And I think there's a growing realization that a lot of those people probably didn't need to be there in the first place. And so I think we will see much more engagement with offenders, trying to keep non-violent offenders and also vulnerable people out of the corrections system. And as I say, purely because it's just it's becoming just too expensive. And so, you know, I do think there's positive signs for the future.
Thank you. Thank you. Philippa, would you like to say a final word?
Yes, I think I just responded to the last question posed immediately after on the chat box, but I'll just refer to that one because that's an important aspect, which is the fact that of course, the international organizations have a role in raising awareness of these problems and trying to influence governments to take different measures, but then it will be up to the countries if they want to implement them or not. And this, as you have mentioned, Audrey, will depend so much on political will. We have been observing in Europe a recent shift in terms of governance from the ministries of justice or interior to the Ministry of Health. And in this particular aspect, I think it has an important impact because there's so much intersect between the safety issues and the health issues. And you always need to take a more inclined tendency to health if you want to have the interests of those that are more vulnerable in terms of health issues protected. So this is, of course, a position that WHO defends very much and is keen to continue to support among member states that want to do this transfer.
Thank you. Christopher, would you like to say a few words, or if you want to conclude?
Yes, indeed. What I want to say is that, you know, one of the things that we really need to talk to our authorities, and maybe what we need to do, is the safety net for parolees, because we have seen in our country that parolees have got about a 40% chance of returning back into correctional services. And we need to find that, engage the authorities, and how we create a better safety net for parolees. But what we can say is that, you know, COVID-19 was also used as a cover in some places where we picked it up for abuses. And we pointed that out, and we're very happy to report that, you know, wherever we pointed out those sort of abuses, the authorities have responded to it positively, both in terms of whether it was alleged assaults, or whether it was the food or the water or the other conditions within the correction service centers, or even uniforms. That was also an issue. But thank you so much, and thank you for giving us this opportunity to share with you, always your colleagues in the NPM. Thanks.
Thank you so much for participating, Chris. Jabet, would you like to provide final comments?
Yes, thank you. I think what the pandemic uncovers, even in places of detention in our country, in the Philippines, is the existence of underlying unfair social and economic structures. So this is the bottom line here. But on a positive note, we are hopeful still. We are hopeful because as of now, there is a growing advocacy efforts of many civil society organizations and lawyers groups to convince our Supreme Court. Particularly yesterday, they issued a statement that which is unprecedented on the part of the Supreme Court to make a statement condemning the killings of many lawyers here in the Philippines. So it is unprecedented. So for us as civil society, we believe that justice is not only the judiciary's task. The civil society has also their respective tasks in order to improve the criminal justice system, particularly here in the Philippines. And now, with the recent case of a pregnant person, pregnant PDL, who gave birth inside the detention facility, there is now a move for the Supreme Court to issue we call it a petition, writ of kalayaan, or petition for freedom. Petition for freedom. It is a petition or a immediate measure for those individuals who were arrested for low offenders. Meaning this kind of petition, I believe, maybe PDLs to bring PDLs to a more humane level, and to bring those persons deprived liberty to claim their right, and to claim their right that they have, based, of course, according to the international standards. Thank you.
Thank you, Jabet. Final words from Sugali, and then I think we're going to go to the conclusions.
Okay. Thank you, Audrey. Em relação aos comentários feitos sobre o Brasil e sobre a pouca e a tímida redução,
about the small reduction of the incarcerated population, because this incarcerated population is young, it is important to understand that pandemic shouldn't be the only justification to reduce the incarceration in Brazil. The incarceration crisis, it dates from way back, and it focuses on Black people who are poor, who live in the outskirts of town. And we are seeing an increase of the dissemination of COVID in the detention centers, both in the staff and in the incarcerated people. In Minas Gerais, we have babies who are contaminated with COVID-19 inside the prisons, besides pregnant and breastfeeding women. If we don't address the roots of the problem, this is not going to change. So the COVID-19 pandemic cannot be the only justification to adopt disincarceration policies. I think we should walk towards reparation for people who are in jail today, because the deprivation of freedom restricted other rights now, like the suspension of visitors, the reduction of sunbathing hours, the reduction of the number of foods and hygiene materials that enter prisons. So we need to adopt reparation measures, maybe in reduction of sentences or in alternative measures. We don't know, but we need to think about reparation measures, because we're seeing the dissemination of the virus in the detention centers.
For your final words. I can see that some of our attendees are leaving because we are 3 minutes past the time. I want to thank you, Danielle, Tina, Gloria, also for your great questions and comments. Great thank you also for our speakers and our interpreters. Before leaving, please can you remain with us 2 minutes, because Barbara Bernat, our Secretary-General, will wrap up, and when she wraps up, she's always very, very good. So I really encourage you to remain with us a few more minutes online. Thank you.
Thank you very much, Audrey. I will try to be.
Baba, you on mute.
Yes, yeah. Sorry, mistake. We had a very rich discussion and a real debate and conversation across the globe on these important issues, that there is a need to take measures to address the risks of COVID spreading in prison settings, what Gerbert called the COVID time bomb. And I think the discussion through the practical examples in the 3 countries and the global analysis led by DLA Piper show that these measures are really key to prevent and control the COVID, and also reduce overcrowding in this regard. So measures were taken in the countries, and we heard the examples, the concrete examples, but also in the 53 jurisdictions. And it really was helpful. There were some difficulties in the implementation in practice, but it was effective, as we heard from WHO as well. And also now there is a kind of concern with a kind of reversing trend. Also, there was a marked decrease in the first period, which was covered by the study, March, July, and now there is a light increase again, and we have to be very careful with this in this regard. Three more comments maybe. We also discussed a lot the measures and the modalities of implementing the release schemes, and especially this eligibility criteria that were presented and also discussed, and especially the exclusion of some categories of detainees from the possibility of release, and especially the non-violent drug offenders, but also some vulnerable groups, and trans people were mentioned, but also women and children were not really specially represented. Then the support scheme for people who are released were also quite discussed quite a lot, which was also very interesting. Of course, there are difficulties and challenges in implementing that, and this was also discussed. And in all the 3 countries, Philippines, Brazil, and South Africa, the issue of pretrial and remand detention lies quite at the core of the issue and should be addressed better. Then there was discussion as well about the issue of the resistance, especially resistance from the judiciary, and the importance to have the judiciary on board and also look at the court system, which was mentioned by several countries. And despite for example, in Brazil, a very progressive resolution proposed by the National Council of Justice with very good criteria that were not really always implemented. But to end with a positive note, I think there was a trend, there was a momentum, and I think Triona said we now have to see how we can keep the momentum going. And there are possibilities and opportunities, and I think one of the issues that was discussed is that release schemes are not the only measure and should be combined with a lot of other measures, and especially non-custodial measures, especially implementation of alternatives to detention, but also diversion, for example, for drug offenders. And all these together, the idea is to reduce the prison population altogether and reduce the overcrowding. We looked as well, it was just mentioned now about the safety net for parolee, and yes, in general, less use of custodial measure. There are some leverages, and the issue of costs was mentioned, and I think we have to put the conversation on the issue of costs, and I'm not thinking only, and I'm thinking about the social cost and the societal cost of detention for the detainees, for the families, for the societies, but also the financial costs. And this was mentioned as well by several speakers, that detention is the cost of incarceration very high. So I think what this conversation shows is that it is possible. I think, as Patrick just Nicholas Patrick just said, it shows that it is possible to reduce the prison population when there is a need, and what is possible in times of crisis should also be possible in times of nice weather, if we can say so. And I think, yes, the result is we have to join forces, international organization, national preventive mechanisms, civil society, and others interested in this issue to go forward and make this, what happened now in the last year, make more sustainable, to have less persons in prisons. And I would like to end maybe just to give a series of thanks. First, a big thank you to DLA Piper and Nicholas Patrick for inviting the APT in supporting their research, but also in the great cooperation in the organization of this webinar. Of course, I would like to thank you all the speakers who contributed to this rich discussion. Also thank the APT team, and in particular Audrey, who did a great work on all this issue and this program today, and thank as well Alexia and Veronica for the support. But of course, also thank you all the participants for your interest and your time in this, and last but not least, the interpreters who made it possible to have this in 4 languages. So I just thank you, merci, gracias, obrigada, and I wish you a nice end of the day.
Thank you, everyone. Thank you so much. We have recorded the webinar. You will receive a link. Thank you.
Thank you.
Take care of yourself.
Thank you.
Thank you all. Take